And joining us live via Skype is Dr. Shailendra Sham, the chairperson of the South African Medical Association and Employed Doctor Committee. Thank you so much, Doctor, for your time. What are the concerns of doctors regarding the extremely long hours you have to work?
Thank you very much, Cindy. Good evening to you and to your viewers. The general South African public is well aware of the challenges facing the South African public healthcare system, ranging from staffing levels, infrastructure, equipment, etc. One of the areas which is not as well known is the extremely long hours that doctors generally work. These are far in excess of general working hours. Doctors usually baseline hours that they work for a normal working day, and most healthcare institutions offer services on a 24-hour basis. It's usually those same doctors who have already worked a normal working day who then end up working the night and covering the emergency after hour service, and in many cases have to then continue to work through the next day to cover their normal day-to-day responsibilities. This ends up resulting in shifts of varying between 20, 24, up to 30, and in cases even beyond 30 hours, continuous work without a break.
So this is more like a labor relations or rather reform that needs to take place. Are you engaging the Department of Health and Labor at this level?
Definitely we are. It's actually a multifaceted problem. From a labor point of view, the challenge is that there is absolutely no regulation in place in South Africa to limit or regulate the number of hours that doctors work. So obviously there's requirement for reform in that area. Having said that, there are also operational and service delivery requirements in institutions. There is a general belief by hospital managements that it is necessary for doctors to work these extremely long hours in order to provide a particular level of service, without the realization that the level of service is actually significantly impaired once a doctor has been working 24 or 30 hours, for example, in one continuous stretch. We are therefore addressing the issue at a number of levels. Firstly, from a labor point of view, we are engaging with the National Department of Health, and there's very positive engagement that has taken place in that regard up to now. And we hope for this process to result in meaningful policy change in the foreseeable future. It also requires a change in mindset within hospitals and health institutions. Amongst our own colleagues, particularly senior colleagues who have been working under these conditions for many years and decades, and who have actually come to accept this kind of situation as being the norm, as well as the managements of these institutions and various levels in healthcare administration, who are used to this kind of working hours being used to plug various gaps and deficiencies elsewhere in the system. And the realization that all of these deficiencies cannot be plugged by simply expecting doctors to work extended hours to make up for the deficits. There obviously needs to be direct addressing of the various deficits in the system without the reliance on doctors to make up for them.
What would you like to see change in the short term, or what is attainable or doable in the short term?
Well, in the short term, we would like to see a completely unregulated process, at the very least, become regulated, and some degree of interim capping of work hours, such that an interim solution is put in place while negotiations are ongoing for a permanent solution. Our proposal to the Department of Health, as well as the Health Professional Council, is for an interim cap of 24 hours with an allowance for a 1 hour handover period that could be initiated and implemented in a very short period of time. This will at least introduce some form of regulation to the system. It will also develop a process whereby health administrators and institutional management now start looking at the issue and start preparing themselves for a final long-term solution.
Dr. Sham, we're going to leave it there. Thanks indeed for your time. That is Dr. Sham joining us live via Skype. He is the spokesperson of the South African Medical Association and an employed doctor.